Care navigation is actually a model of care that was developed in the early 1990s in America. One of the things that appealed to HealthWise was its applicability with people from a core background and a refugee background. What is really applicable here in Armidale is that empowerment perspective for people to be able to build capacity, build agency, to think for themselves, to know that the choices are theirs.
In 2018, when the refugees arrived, we didn't have the Care Navigator, and it was our role as GP to not just care for the physical and mental health of the patient, but also to educate them about the health system, and we faced a lot of challenges. But the Care Navigator made a significant difference. She played a vital role in helping the refugee understand the health system in Australia.
What's been missing and what the Care Navigator position has really made a difference with is linking our provision of local health services in the public health system with the provision of primary health care through GPs, but then importantly also to private pathology, private specialists, pharmacy, so that the community knows where to go and how to access all of the services necessary.
There's not an overly high level of literacy in any language. So a lot of support is required through verbal support. And so to have somebody to be able to bridge that link a little bit in the Care Navigator role with a local community member employed to provide the language support, that's really quite invaluable.
One of the things that I'm really pleased has come out of this program is my own cultural understanding and also HealthWise's cultural understanding of the Esidi community. The interpreters that work with us, Kaso and Jehan, are fantastic.
The program means a lot to me actually, because I'm enjoying to help my community here. As you know, we are new in Australia, so we do need help.
It helps me to improve my English, and so also it means a lot, especially because I'm working with the Esidi community.
Having people within the community working with services, whether it's a GP practice or a pharmacy or with us in a health service, really makes an important welcoming approach and a way for people to know that these are trusted services that they can go to.
One of the most invaluable things we have done is hire people from the community, and ideally just evolving those roles into becoming a care navigator themselves, to be able to go forward and then help people from their community on a more meaningful level.
قال لك مثلا برادري دو كاوني ماذا بمترجم يعني وقلتي أم بقول مرتاح هناك ونما ربنا بنكاره ونلبي من نظام دبان إكسر بنكاره راستي.
Yes, we're very happy with the interpreter available from our community with Care Navigator, so that will help us to understand better. So we are very comfortable with our people to be interpreter for us.
And now what has changed is they know exactly where to go. They've been more engaged definitely in the health system. They know when to ask for help and where to ask for help.
There's a survey before we exit people from our program. We ask them what is their comment or idea about our program. So what they are saying, it's all positive comments, and they are very happy about our program and they find it helpful.
ببرنامج مثلا قلت مع سابق كيش أرميدار وقلت الشغل ما مستشفى تختورة يعني قلت شنها مش كبيرة بدبا يعني وقلت إيش درجية يعني كنا شو عم بايته احتمالا ما نكان كوبا يعني بدها بريدة.
That program helped me a lot, especially for me and my family, because if that program won't help us, so we couldn't go anywhere and we couldn't do anything.
So I'm currently seeing about 220 out of the almost 600 refugees that settled here in Armidale. Of course, beside my local Armidalian patient. A large number of the refugees have really complex physical and mental health. In order for me to do a good job, I need to concentrate on what I do the best, which is just checking the physical and the mental health, knowing that I've got a partner, which is the Care Navigator, who is going to go through booking appointment, cancelling appointment, rescheduling appointment, and all of the other things that can help the refugees.
Looking at other communities, whether they're refugees, but also people with disabilities, people from migrant backgrounds, people with low health literacy, having a role like the Care Navigator role is really important because it simply links everything that for someone like me is much easier to understand. But if you don't have that health literacy or health knowledge of our services, it is a very complex system to navigate.
That underpinning empowerment approach is so important. Acknowledging that people have their own agency, people have their own strengths, and instead of doing for them, helping them to do for themselves.